Hey everyone, welcome back to my channel. My name is Kelly and I am a physical therapist and I specialize in oncology and lymphedema. In a past video, a recent video, I talked about different pads and foams that I use for my patients with lymphedema that can be used for their compression bandaging routine. One of those things that I talked about is a chip bag. And so what I'm going to do today in this video is go through how you can make a chip bag at home on your own. A chip bag is basically a piece of fabric or a liner that is filled with different shapes and sizes of little foams. It creates almost a little bit of a pillow, and when that goes against your skin or a more stubborn swollen area, it can help give really good compression against the swelling to help shrink it, but also help break up that fibrotic or thickened tissue that someone may have. It is something that you can purchase or you can buy. They come in different shapes and sizes. They're called Swell Spots or chip bags, or also Jovipaks. But it is something that's really easy to do on your own. I'm going to show you how you can do that with some of your lymphedema supplies you may already have. So first off, what do you need to have? The first thing you'll need to have is your old foam. So if you have been using different types of foam, you can go ahead and pull out the scraps of that. I have different gray foams which are pretty standardized for lymphedema. I also have Comproflex and Comprex, which are two different types of foam. One with the patterns or the ridges, and the orange foam or the Comprex is more dense. So I'll use scraps of that. And if you have anything like Rosedal Soft or Comproflex or anything else that you may have at home or that you may buy at a craft store, you can feel free to pull that out and use that as well. Another thing that you're going to need is something to put the chips in, or the foam in. And so I have, we call it Tetra Grip or Tuber Grip. It's just the liner that we use on top of someone's compression bandages to help hold it on. It does a nice job because it has a little give to it with its stretch, so it's easy to form into different shapes. You can also use something like a sock. If you don't have a liner or you don't want to sew one or make one, you can pull out an old sock and cut that up and fill the foam pieces up into make a little bit of a chip bag with a sock. I recommend having a place to put all the foam pieces in as we go along, so you can pull out a box or a bag or anything that you will use, just so things don't make too much of a mess. You'll need scissors to cut up your foam, and you're gonna need some sort of tape to close it all off. So this is Medipore, which is a surgical cloth tape. We tend to find that works really well against the fabric. If you don't have something like that, you can use something like duct tape, or good masking tape works as well. You just want to make sure that it does adhere to some sort of fabric so it stays closed. I've seen people even sew up their liners and close them shut, and that works well if you want to do that. The last thing that's not necessary, but I do recommend, especially if you're working with gray foam, is to have some sort of lotion ready, especially if you work in or live in a dry area. So the gray foam tends to get a lot of static and dryness to it, so you'll get stuck to it a lot. And so when you have issues with foam getting stuck to you, it's easy just to put some lotion on, and that helps a lot so you don't have as much issue. Okay, so let's get started. What you want to do first is, again, think about that shape or size that you want to make for you. If you want it for the back of your hand or the top of your foot, you want to get your liner ready to fit that shape. So for me, I am just going to make probably a thin one for the top of the foot. So this is about the width of a foot. Again, you want to go just slightly smaller if your liner is stretchy. But I'm gonna think about the top of a foot being about that length. You can go ahead and measure it yourself if you want. If anything, make it a little bit too big or too long, and you can always trim it back down. So I'm gonna cut my piece, and that's the shape or size that I'm gonna make. Again, you can make them as large as you want to. So now that I know what my shape is, I want to make sure that I have enough foam to fill this. So what I recommend doing is just to take some time and go ahead and cut all of your foam pieces up and put them in a pile or a group in your container. So I'm going to go ahead and do that now. Okay, so I cut about a bag full. That will be plenty for me, but again, if you have a larger one, you're gonna wanna cut a lot more. If you wanna make it easy, I probably would recommend putting it in a big container or Tupperware so you don't have to hold the bag upright. But then you're gonna go ahead and move all the rest of your foam out of the way, and you're gonna be left with your chip pieces of your foam and your liner. We want to fill the liner, so what we need to make sure you do, unless you have the end like a sock or you've sewn it closed, you need to make sure you're secure one side. So I'm going to take my tape and cover one edge. And this tape has perforated edges for me, so I'm going to go ahead and rip it or cut it up if you need to. And what you'll do is you're going to put one edge in the middle, or again, you can sew it up like we talked about. I'm gonna fold up the other end. Try to line it up as much as possible. Okay, and then because I have a little extra, I'm just gonna trim down the edges a little bit so I don't have as much fabric hanging off the edge. Okay, and if you feel like you're gonna wanna use this a lot and rather not just a couple times, you may wanna enforce the ends. So what I'll do, I'll take another strip that's thinner, oops, and I will fold it over the edges on either side. Okay, and that's pretty reinforced. That's probably a little bit more than you even have to do sometimes. But, so one edge is fully closed. What I'm gonna do next is I'm just gonna fill it up. You can fill it up as little or as much as you want. You just need to make sure that you can close it. I try to fill it up pretty well because over time the foam will compress down and it'll be a little bit thinner. So the thicker it is now, the longer it will last. If you have a fabric that also has some give to it, you can really fill it up and it will stretch it out and help form it a little bit better. So again, I have an array of foam, so I'm just gonna go ahead and fill up my piece. Okay, so I filled it up all the way. I've kind of pushed it down into the edges, and I'm gonna press it down a little bit more so I can close it well. I can get some of that fabric to lay flat, okay? So I'm gonna take my tape again, another piece, or again, you can sew it at this point. And then what we'll do is try to line up the fabric on either side and lay it flat in the middle, and then fold over the other side and close the edges or equal out the edges. Okay, and I'm going to do the same thing on this side. I'm going to trim down a little bit on the sides. And you can do the same thing and reinforce both edges if you want to make it look nicer or last a long time. So I'll just do one. Speed it up here. Make sure it's closed as well as you want or sewn as well as you want. So what I typically do is take some time and kind of move the foam back and spread it back out so it will just be dispersed evenly. And you can shape or form that a little bit more to how you would like. And then you have your chip bag. So again, you can use this against in any area that you have a little bit more stubborn fluid. Put it underneath your bandages, put it underneath your foam to help break up some of that fibrosis. And it is soft depending on the fabric you use, so it is a safer option than something like Comprex that's a little bit more harsh or dense. So if you found that helpful, please let me know. Like it down below or put a comment down below if there's any other topics that you would like to see covered. Thanks everyone.